Approximately 750,000 people in the UK suffer from heart failure, and on the whole it has a very poor outcome. Patients are symptomatic, have poor quality of life, and ultimately die at an earlier stage than they should do. One of the biggest problems is that there is inequity in care across the management of these patients. This was highlighted by Lord Darcy's Next Stage review when he asked healthcare professionals, managers and commissioners to identify areas where improvement could be made in order to improve the quality of care. And one of the areas was an electronic pathway for heart failure patients, so that once they were diagnosed in primary care they could be referred into secondary care, receive expert management, then be referred back into primary care, all in one seamless movement. Unfortunately, we found that many of the systems involved in primary and secondary care didn't communicate with each other, so our challenge was to find an electronic pathway that would bolt together the paper pathway that we'd already produced in Liverpool. We found this would improve the flow of information, so once the GP had seen a patient, there would be standard referral criteria. The consultant would then see the patient and advise the GP on best management, and the patient would be referred back to primary care. If in primary care further problems arose, there were automatic triggers for referral back into secondary and tertiary care, so that all the patients got the best treatment all the time, with timely referrals and good availability of information between healthcare professionals.
To support the heart failure pathway, it was important that there was information management and technology intervention in this to ensure that all the acute trusts, the community trusts and the GPs could share information across the pathway. This will be done by using the Trust's current information systems and ensuring there's interoperability between them. The other important part from an IM&T perspective is that the Trusts were able to share diagnostics. This ensures that patients aren't repeatedly having the same diagnostic tests, and also that they're sharing echo images across the acute trusts. This is actually a huge challenge because currently none of the heart failure teams use any sort of electronic clinical record. So the starting point for this is to ensure that each of the teams is using an electronic patient record. Once we have them using those records, we can then look at the interoperability and the way we can actually share that information across all the heart failure teams and with GP practices.